Hello. So I'm just going to quickly introduce our panelists, starting to the left of me, Dr. David Kirsch, Head of Radiation Oncology at Princess Margaret Cancer Center, followed by Riaz Bandali, President of Nordion, and then Dr. Cornelia Hoehr, Director of Life Sciences at TRIUMF, and last but not least, Paula Resende, Investment Lead for Life Sciences at Invest Ontario. So thank you for joining us today. And let's dive in as we talk about Canada on the global stage. So the first question is for everyone. I'll start with David and then we can work our way down. Canada has a strong legacy in isotopes, but we are at the risk of losing our ground globally. Where do you think we have the clearest opportunity to lead?
So I think we have a history of great success with isotopes within the country. I actually think one of our competitive advantages is our ability to collaborate. So collaborating across disciplines, nuclear medicine, radiation oncology, medical oncology, collaborating industry, academics, departments. And sometimes there's a concern that things are kind of resource constrained, but if that brings everyone together working as a team, I think it can actually help us get more done.
There we go. All right. So thank you. I think we have an 80-year history when it comes to medical isotope production, provision, and processing. Right? So I actually look at it a little bit of a different way. I know we're positioning this as, hey, what's the threat to make sure that we continue to have an opportunity for Canadian growth? I'd be sitting here saying we've got a global leadership position, and our focal point should be on how we continue to accelerate that global leadership position. I know we'll get a chance to talk about that during the panel, so I'm not going to kind of comment on that right now, but to say I think we got to turn our mindset from how do we be defensive to making sure we can be progressive with regards to maintaining our leadership position.
Thank you, good points. The other strength that we have in Canada, which is great, is our ability to innovate. We have a lot of talent, a lot of infrastructure that is unique in the world, and we really should take advantage of it, and we are, but we should do this not just as individual institution, and it would be good if you're doing it nationally, and then really drive that into the global ecosystem.
Yeah, those are exceptional points from my panelists here. And I just want to draw maybe on something that James said earlier, because he's such a proponent of this ecosystem. And this is a place where Canada has been leading for decades, and truly, that momentum is certainly continuing. But this was really, we're benefactors of the investments that were made in the 1970s. And I think, there's a lot more investments that obviously need to happen, but we are in a privileged position. But Holly, as you mentioned, this is still a race. And we're seeing, a lot more countries come to light in terms of what they're bringing to the table, more nuclear refurbishments, more small modular reactors that they're currently building. We're seeing it in China, the US, Russia. A lot more players are coming to light, so we can't just, carry on that legacy without that commitment to innovation. And I think a ton of groups here, we're seeing it in this room. There's so many people that are contributing to this changing legacy. So I'm encouraged to see it. We're in an exciting place, and let's see where we can take it.
Thank you, everyone. So next I'm going to go to you, Paula. I know that, David, you did touch on the fact that we are highly collaborative within Canada. However, I just wanted to know, how could Canada better align their regulatory frameworks, investment environment, and industrial strategy to compete with rapidly advancing international players?
Yeah, I think you said it. Truly, we need government, academia, industry all aligned in order to actually push this agenda forward. I'm seeing it this year, and if anything, this conference has grown astronomically in the last 3 years. So I'm encouraged by all of the folks that are coming together to have these conversations. But of course, a lot more needs to be done. And from a provincial perspective, if I could lend that perspective, we're seeing more receptivity to having those conversations with industry, certainly at a federal level. Our Prime Minister is having those conversations, our Premier is having those conversations, and we're also making bold ambitions. So, James mentioned it today that there is a commitment to doubling our isotope production, and we're well on our way to achieving that. Same thing with our commitment to net zero energy, that we are planning on getting there by 2050. So these are bold actions that have been put in place with industry and with government, with the support of the Building Ontario Fund, with the support of the Ministry of Energy, alongside Bruce Power, OPG. So these are all bold actions that are happening, and obviously more needs to happen. And maybe if I could share too on the regulatory side, because that came up a lot today as well. This is an age-old problem. We've seen it in biotech, we've seen it in a number of other industries where Canada is phenomenal at research, and certainly you can speak to that. But we're not great at commercializing, and we need to get better at that. There are still patients that don't have access to the cobalt-60 therapy that we championed, in 1951. So a lot more needs to happen on the regulatory side, but at the same time, those conversations are happening, and I'm seeing it, and I'm encouraged by that growth.
Great, thanks, Paula. So shifting gears a little more to the startup side, Connie, I'm going to come to you. What role should Canada play what role should Canadian startups and scale-ups play in shaping the country's global influence? And importantly, what do they need most to succeed?
Yeah, so we at TRIUMF, we do have actually quite a few success stories for startups where we are driving then into successful companies on the physics side, on the technology side, but also on the radiopharmaceutical sides. And startups are incredibly important to get something onto the market. Like take an academic idea that otherwise would then go into a paper and maybe vanish into a drawer, and get it onto the market. And if it's a Canadian startup, hopefully stay in Canada and then reap the economic benefit in Canada. So that is a really important part of the big puzzle, how we're going to be successful internationally, because then we have the strength and hopefully we can keep it in Canada. Now, what you really need from an environment for a successful startup is, for example, if it's an idea that a researcher has as a research institution or university, we need to give these people the room to do it. So we need to give them support, IP support, protection, research security. Research security is incredibly important to make sure we're protecting Canada, but then also it needs to be fast enough and easy enough that there isn't this huge hurdle to do it. We also need to free people, like from their day job, so they can actually go and be creative and be an entrepreneur and kind of do it. And I can't stress how important that is, because we all have our day jobs, and not everybody will quit their job to kind of start a startup. So having a little bit of this protective space, I think, is really important. And then IP protection is really, really important. And then it goes back into maybe even undergrad at university, and many universities do, but it probably could be more tailored to the pharmaceutical industry, because it's a very special industry with very unique problems. How to actually go about doing your own startup companies, placements with companies, like shadowing somebody along, I think is very important. And funding, of course, seed funding, so people can actually go and have their ideas. And I must say, over the last 5-10 years, this has gotten better. So 10 years ago, when we had an idea at TRIUMF and we wanted to do it, there seemed to be in the federal funding programs this lack. It was an idea, but not grown enough to kind of really attract a company to do it. While with collaborators in the UK, they had this funding, so our idea went into the UK, and it's now in the UK, unfortunately. But yeah, so it's better. There are programs now in Canada that really help keeping these ideas and then these startup companies in the country.
Great, thank you. I would just like to touch on that as well. Being a part of the CMIE and our development fund, we're mostly targeted in our development fund for offering non-dilutive funding for startup companies within Canada. We have seen, obviously, the funding is a large part, but also one thing that we have seen consistently is that the access to shared infrastructure and expertise across Canada, when you're a small, agile company and you're cost constrained, being able to have those partnerships is highly valuable. And if you're moving into the radiopharma space from a different area or you're relatively new, for example, I'm going to call on Yellowbird Diagnostics. They're one of the companies that we've funded, strong radiopharma background, but moving from that radiopharma research into the actual clinical space. They needed people to lean on, and being able to have that within Canada has resulted in them producing their first in human in Canada, in Ottawa as well. So being able to keep that IP and that value add in Canada is incredibly important. Okay, next, we're going to keep on the financial train and talk about capital. I'm going to go to you, Riaz, and then follow up with Paula. How can Canada attract and retain capital to support long-term growth in the isotope sector?
So anybody who knows me knows I can talk about this for an hour, so I'll try to keep it very constrained with regards to my comments here. But I've thought about this a lot, and I kind of think that there are 5 steps that we need to think about when we look at Canada. The first one is innovation, right? You've heard a lot of that over the last 2 days, right? And I think we get a check mark on innovation. There's a lot of great innovation going on across Canada. We've got clinicians who are very committed to progressive patient outcomes. So all of that, I think, bodes very well. I think we've got to continue to focus in on making sure that we think about training people who are going to be actively involved on the health and the nuclear side of this is one thing I think we need to think about. The second thing is that if you think of technology ecosystems that have been successful in the world, there have been some characteristics that are cross-spectrum. And the first one is that you've got a civic infrastructure that supports the ecosystem. And so a shout out to the Ontario government, the Canadian federal government, as well as municipalities and First Nations, right? I think thinking of nuclear medicine and this isotope sector is something that's important, is something that's coming across from our civic infrastructure. The second thing is a trade organization that is a proponent and an advocate for the sector. So a shout out to the CNIC, because they've done an amazing job building awareness of this sector. So that's the second thing. The third thing is capital, right? So we just heard about capital, right? And when I say capital, most people, when they think about early stage and building up a thing, go to venture capital. But I actually don't think we need more venture capital. And as a reformed venture capitalist who's 22 years into his reformation right now, I'll tell you why, right? So the first thing is venture capital industry is a copycat industry, right? We've had great successes with Point and with Fusion and to some extent also with Artemis, right? So venture capitalists will pay attention to therapeutic assets in Canada. The second thing is that's a risk-based oriented financing approach. It's 100% equity. So they look for assets that they can get through to phase 2, and then they look to exit because they're looking to maximize IRRs. That's great for the venture capitalist. At the end of the day, not so sure from my perspective, it's great for building a sustainable ecosystem when it comes to flagship companies moving forward, right? The third thing is they don't really like service and or supply chain companies. Of the 100 companies that are here, the vast majority of them are service or supply chain companies. They like therapeutic assets because they've got a built-in buyer. If it works, high risk. If they've got an exit before any dollar of cash is earned, they're out, right? So what do you need? You need private equity, right? They look for service-based companies or supply chain-based companies because their model is based on debt as well as equity. They try to deleverage debt. That means the company actually needs to be making money and growing revenues. So I think there's a great opportunity here if we look at private equity to help support those companies that we have that are supply chain and service companies. And I think it's actually atrocious that companies like Atom V, if I look at Isologic, if I look at Nordion, we've had to go to US-based private equity companies to grow companies that have created sustainable infrastructure in Canada. The fourth thing, which is probably a non-Canadian thing, right, is we've got to be much more laudatory about success. The success stories in Canada, we've got to cheer harder. We've got to shout them from the rooftops, and we've got to move the dialogue from wealth redistribution, which we love to talk about, to wealth creation and actually incentivizing more risk-taking and then celebrating that risk-taking. We get into dialogues around things that make me shudder when it comes to thinking about how we're trying to de-incentivize risk-taking, and we're talking about just wealth redistribution. We got to talk about wealth creation. And then the last thing, for those of you who are sitting here saying you just said something that was very un-Canadian, the last thing I would say is we have to have trust, right? The world needs more Canada because, one, Canada realizes that winning is not a zero-sum proposition. For me to win, you don't have to lose. Canadians understand that. The second thing I would say is collaboration, right? That was just mentioned. We've got a great history of collaboration, which should give you comfort. And I would take that as an example right here. This conference 4 years ago had about 70 people in Vancouver. People want to collaborate. This conference 4 years later has about 500 people, all of whom want to work together and collaborate. So trust the world needs more Canada.
Those are all fantastic points, and maybe if I could just lend the perspective of a public investor, you know, that's our bread and butter at Invest Ontario. Every day we're getting more and more attention in this space, and I should say both on the domestic side of things and the international market, more and more companies are coming to us interested in talking about this ecosystem and how they can get involved. And the top things that are always coming to mind, and you know, can you answer these questions for me, Paula, is, you know, do you have the talent in order to sustain what I want to do here? Do you have the ecosystem? Like, who are the partners I can work with as soon as I get here so I can hit the ground running? And ultimately, do we have, especially right now, a geopolitically stable supply chain? And Canada does have all three, right? We're seeing so many collaborators in the space wanting to work together. So we're in a great position, but it's true. There's a lot more that obviously needs to happen, but we're scaling that quite quickly. And maybe you mentioned AtomV, and AtomV is one of Invest Ontario's a company that we supported. But I should say, again, credit to Bruno and his team. You know, he recognized that there was a strategic gap in the ecosystem. We needed higher throughput for GMP manufacturing of these radiopharmaceuticals, and he filled the gap. He went out, he got the capital, and I should say we played a very, very small part. But at the same time, you know, we were able to promote this incredible success story of a company that landed in Hamilton, grew up in Hamilton, and has stayed in Hamilton with the support of the ecosystem around them. So that's just one example where, you know, we should be shouting our successes from the rooftops. And I agree with you. Let's be Canada strong and make sure that we're not just being humble and we're promoting ourselves as we should be to the international stage.
Fantastic points from both of you. Thank you. So, Riaz, I know you touched on the infrastructure piece, and I'm just going to go to David first. But as Riaz mentioned, we do have some really strong infrastructure within Canada. How do you think we should approach our infrastructure to support our global ambitions? And as we continue investing in large-scale infrastructure programs, including production and processing facilities, how can we ensure that this infrastructure remains an anchor for investment, IP, and people?
Great question. As I think about infrastructure, I think about it, again, from the university or academic perspective. Part of the infrastructure that we need is infrastructure for treating patients with radiotheranostics. We can get some funding from the government, but that usually isn't enough to have a world-class facility. So at Princess Margaret, we've been fortunate to have donors, the Silber family, who are supporting a new theranostic center that we just broke ground on. So I think part of the infrastructure is through public funding, partnering with either investors, as we just heard, or philanthropists to provide the infrastructure that we need to treat patients with theranostics. But also, there's the research and development piece that also requires infrastructure. This is the wet lab space, the radiochemists, and that again needs public funding from grants and also support from institutions and industry.
Paula, do you have any thoughts on this point?
Am I on? Yeah. Certainly as a, as a group that funds infrastructure, we have a lot to say on this piece. And, I can say that there's a lot that maybe on the economic development side we could likely do better, but there are some things that we tie our investments to make sure that we are thinking of the long-term lens and how these companies can grow and scale in Ontario. IP creation is a big piece. So, we make sure we're leveraging, of course, taxpayer dollars. So we want to make sure that these investments are worthwhile and fitting, the ecosystem strategically. So one thing we can do is if we're investing in a company, we want to make sure that there is some level of IP creation and a future commercialization plan in place. Another thing we can look to do is providing incentives should a company automatically need to choose to relocate. We want to make sure that they don't do that. And so, there's certain incentives we could do there. And of course, just in terms of training, the next generation of talent, obviously there's a gap here, but there's a lot of folks have shared that, many are retiring in the space. But, making sure that the next companies that come through, whether domestic or international, have a training plan in place so that we can train the next generation. We can tie all of that just to our investments. And one thing I do want to echo too that the minister from Saskatchewan mentioned today is that this is something I didn't realize when I first entered government, is that they don't necessarily know what they don't know. And this, I'm learning it every day, but there is a commitment to learning, I will say. And this is an especially difficult space if you have never really been in it. And so I would encourage all of the companies here today, all of the groups, have an ask. Tell government that you have an agenda, lay it out, offer a solution, and help explain why it's worthwhile. Because if you get enough people on board, they will support it, but they need to understand it better. And so I would encourage companies certainly to come talk to me, have us be that one gateway into different government groups. We want to be partners, but it's an ongoing conversation certainly to change all of these.
Great, thank you. I agree with it being a harder industry to penetrate, especially with all of the acronyms that we constantly use. So that could be a little bit difficult. Okay, so we're going to be shifting gears a little bit. Yesterday we heard from Remy from RC14 about the uses of isotopes for non-medical applications. So I wanted your opinion, starting with you, Riaz, on what the most promising dual-use applications are for isotope technologies beyond healthcare and how Canada can strategically develop them.
So no bias here, but my favorite isotope is cobalt-60. And although cobalt-60 is used for cancer therapy, that's about 10% of our business from a revenue perspective, right? About 90% of our business is actually focused on sterilization. So to be fair, it's not a non-healthcare application. For us, it's a very impactful healthcare application because cobalt-60 actually sterilizes about 30 to 40% of all single-use medical devices. So if you're in a hospital, anything that's in you, on you, or around you, 30 to 40% of that stuff, whether it's catheters, syringes. James loves to walk around with a syringe to show what cobalt-60 does, right? It was sterilized using cobalt-60. So sterilization is a big facet of what we do with regards to an isotope application that isn't as conventionally thought of as cancer is, right? But still healthcare focused. We are looking at other applications though, right? So right now I would tell you that there's some really interesting work that Nordion is doing. We got a call from the Canadian government to help the Mexican government because there's actually a insect called the New World Screwworm. That's the actual name of the insect, right? That's actually impacting the beef in Mexico, and it stopped the import of beef into the US, and that's a $10 billion industry for Mexico. So they called to see, because there's a technique called sterile insect technique, to go down and sterilize the males to depopulate that insect, hopefully over a period of time, be able to get rid of that. And so we right now are down there helping the government of Mexico do that in response to a request from the Canadian government to restore a $10 billion industry, an isotope application. And the last thing I would kind of mention, we just signed our first deal on this, is the use of cobalt-60 as an isotope that's used in a power generation capacity. That's being used in a system that's going to be deployed for surveillance in the ocean or in the Arctic, and we're even exploring space applications for this power source. So there's a few applications that are actually non-medical.
Very interesting, thank you. We'll go over to Connie from the TRIUMF perspective.
Yeah, so from the TRIUMF perspective, we are, of course, an accelerator lab, so it has to do with accelerators and detectors that we are developing that you can use for other applications, accelerator applications that you can incorporate into the isotope production stream to make it more sufficient. You can observe your targetry, alpha detectors that you can then use in your alpha processing. But the one that I'm really excited about right now is a technique where you take nuclear waste, nuclear long-lived waste from nuclear reactors, and you actually bombard it with high energy, high power accelerators. That's our bread and butter. And what you do is you transform the nuclear waste into something shorter lived, and while you're doing it, you can actually create energy. Okay, so that's one application of accelerators. But these high energy proton accelerators, of course, along the way, can also be used. They have the right energy and this enormous power that you can use it for isotope production. For example, from Actinium-225. And there's a company that I think a lot of you in this room have heard about because they're very active right now going and looking into our unique Canadian landscape because they're realizing that we have a lot to offer. Transmutex, we at TRIUMF certainly are talking with them quite a bit and see how we can partner with them because the transmutex, the transformation, that's a long-term thing, but the isotope production would be a more short-term, mid-term thing. So I'm quite excited about that one.
Very interesting. Thank you. All right, so zooming out a little bit more to the global stage, I'm going to start with David and then go to Connie. Which global partnerships or alliances do you see as the most critical for Canada to expand its reach and impact in the isotope ecosystem?
So I would say on the global stage, I think, again, we need to be strong internally and to have good, strong collaborations internally. But externally, there are other global leaders, thinking about folks in Australia, for example, and other countries that are really pushing forward radioisotopes in the medical sphere. And I think there's opportunities for collaboration both in development, but also in first in human testing. I was just in Heidelberg this past week, and that's where the lutetium PSMA drug was developed. And I think there's opportunities for academic collaborations as they develop other new radioisotope drugs to test them in patients in Canada. Could be another opportunity to get early access to cutting new drugs.
Then also, I think it would be good for Canada to kind of see what PRISMAP does in Europe. That's an important organization. I have been involved in PRISMAP, and I'm involved in PRISMAP Plus. What I really like about that organization is it's a one-stop shop. If you want to develop something and you don't know where to get your isotopes from, or you need help with figuring out your radiochemistry or with your clinical trials, you can apply to them, and at no cost other than shipping, they then team you up with the isotopes in the labs, and I think it's a very powerful concept that we certainly can learn from. And then, of course, we heard earlier today with the IAEA, with all the database work, with all the initiatives, with the research projects that they have, the training, and I think we should look forward. We are in the development world, and we are very lucky that we are, but there is a lot of the rest of the world that we can, if we position all of our innovation properly, then can also open up that market and have the rest of the world really benefit from them. And I think the IAE is a very powerful partner for that.
Thank you both. I agree. I think Canada is really good at collaborating internally. However, collaborating externally is equally as important. And we're seen as a trusted leader in the space. So I think that can unlock a lot of really interesting and powerful collaborations. Okay, so looking ahead, what would be one bold move that Canada could make that would significantly strengthen its position on the global isotope landscape? That question's for all of you, but we're going to shake things up and start with Paula and work backwards.
I think it's been the theme of this conference, truly. It's collaboration at scale. We need to make sure that we're all having these conversations together, and certainly Canada is in a leading position, and we have the ability to get people like all of you in this room together to have those conversations. One thing I do want to say too is that I'm encouraged that we're seeing a national strategy that's being put out by Natural Resources Canada. So there's a roadmap that we can at least look to as to what policies might be in place, what funding might exist, and what else we can do to change some of that. So I'm glad those conversations are happening, and there's no reason why Canada can't champion the next cure for metastatic cancer. I feel like we're so close. Let's all get together and do that. So if I could leave everyone in the room with the, as a last panel, an opportunity to change things, we are ready to do that.
That is awesome. So that's pretty much what I think too. Is like, I think in Canada right now we have a lot of initiatives that are really powerful and very good, and they're really good at doing what they're doing. But I think we need to be a bit more aggressive and bold how to do it. Like we all say national strategy, but there needs to be really an alignment between all the research institutions, the production, the industry, the policymakers, the oversight, and we should all work together and not against each other or compete or not work together. So for where I'm sitting, yes, Canada is incredibly collaborative, but sometimes it seems to be easier for us to collaborate with Europe. And I think that's not a good thing. So in terms for really being global leader, we really need to figure out how we align it all together in, I don't know what it's supposed to be. Maybe it's springing off the CNIC or CMIE or it's something, but we need to come together and really align and work together. And if one production site is down for something, the other one kind of can jump in. And I have the choice of developing 5 new isotopes, so does CNL, should we both invest into that? I would really like to see more an alignment of that, and that would then really position us for the global market.
I think some great points have been made, right? What I would say is that having a very small role in being able to participate in the Commission for Ontario that was focused on nuclear isotopes and innovation with some great other people who collaborated in that, and not stealing the thunder because the report's still to come out. I think there's been a lot of thought on how we can actually leverage capability. It was Ontario focused, but I think it's just as applicable to Canada around all of the elements around collaboration, regulatory frameworks, working with academia, making sure that we look hard at how we can sustain clinical trials and make sure that patients get access to therapies and reimbursement. All of that is covered in that report, and I think the first thing I would say is have a look at that report. We should make sure the people in Canada who need to pay attention to that report have a look at that report and actually do what they are committing to do and which they're enthusiastic about doing to execute that report. So more to come, but it covers all of the elements, and it covers them in a time-phased fashion on what you need to do first, next, and thirdly. And then the second thing I would say is something I emphasized before, right? We have to turn our mindset and our dialogue away from purely wealth redistribution to wealth creation. And it's an uncomfortable topic for most Canadians, but we have to get there, right? We have to incentivize it, and we have to incentivize more risk-taking and celebrate, again, successes.
So I would say in terms of a disruptive idea that would change the future, I think the way we regulate the radionuclides that come into theranostics, that has an opportunity for really a big rethink. So I think the way what China's doing now in general in terms of drug development and testing, and Australia as well, the cost of going to first in human through more advanced clinical trials, they're much speedier, lower burden of cost. As a radiation oncologist, when we deliver radiation therapy, we have a machine that's approved. We can kind of then go ahead and deliver radiation based on the known toxicities of radiation in the body. There's not the same kind of regulatory burden that there is with a drug. And I think we can think of some of the radiopharmaceuticals as just a kind of a radiation therapy. You could imagine a the amount of the drug that you need for a PET scan is low, and you could show that that's safe and you can image the target, and then you know what the distribution is and what the radiation dose is across the body, maybe we don't need to have the same kind of regulatory burden on getting a drug then for theranostics for treatment into a patient, and think of it like as a radiation therapy. And I think that would really lower the costs and increase the speed, and we could become a destination of choice for first-in-human studies.
Thank you, everyone, for your fantastic points. I think that is a really strong point or note for us to end on. Overall, with our conversation today, what I think that we've heard clearly in this discussion is that Canada has a credible foundation, deep expertise, globally respected institutions, and a track record of leadership and collaboration in medical isotopes. But maintaining and growing this position will require deliberate coordination and action moving forward. If there's one takeaway, I think, from this discussion as well as the conference as a whole, it would be that Canada's leadership is not guaranteed, but it is absolutely achievable. I'd like to thank our panelists, Paula, Riaz, Connie, and David, for a thoughtful and forward-looking discussion. And with that, I'd like to ask Julia to join me on stage for closing remarks.